16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hello everyone, we are back with yet another episode of BMC Global Live Hilal Health World, nothing but lifestyle. I hope the holy month of Ramadan is going good for all of you with God's grace. Ramadan Kareem to all our viewers. The mouth is the gateway to the rest of your body and hence oral health is extremely important for your overall health and your general well-being. Today, we're delighted to have with us Dr. Rinkoo Jose, who's a specialist orthodontist at Hilal Hospital. He graduated from the JSS Dental College in Mysore and he completed his master's from A.B. Shetty Medical College in Mangalore. He is an international member of the American Association of Orthodontists and a fellow of World Federation of Orthodontists. He has made a mark for himself in a short span of 6 years as a reputed dentist. Doctor, thank you for joining us on the show and welcome to the show.
Thank you so much, Anu, for that wonderful introduction.
As we all know, during this holy month of Ramadan, you may all need a few tips on how to maintain your oral hygiene and the oral health. So doctor, today he will share a few tips on how to have a healthy lifestyle during the month of Ramadan. And being an orthodontist, definitely we'll talk about braces as well. So doctor, can we begin by sharing a few tips for the benefit of our viewers on how to maintain good oral hygiene during the month of Ramadan?
See, fasting during the holy month of Ramadan is a wonderful exercise in self-discipline. It is considered both cleansing and therapeutic, physically as well as mentally. So during fasting, certain steps need to be taken to prevent it from taking a toll on your dental health. During this whole month of Ramadan, your work timings change, your sleeping patterns change and your food habits change. So you need to modify your oral hygiene habits according to these new patterns. So the first and the most important step is to brush after the suhoor meal or the pre-dawn meal what you have before sunrise. Because as all of you know, any sugar particles or sticky carbohydrates, once it is stuck onto your teeth, it starts to dissolve the outer preventive coating of your teeth, which is the enamel. And what is more important is how long it is staying. So during fasting, the whole day you do not eat anything. So the food particles which is stuck onto your teeth during the suhoor meal is stuck throughout the day. And when this keeps happening throughout the whole month, you end up with cavities. So the first and the most important step is to brush after the suhoor meal. The second tip is to keep yourself hydrated enough during the non-fasting hours. A lack of hydration leads to buildup of bacteria, which subsequently leads to bad breath. Another tip is to avoid oily foods, fried foods, and any carbonated drinks and tea, coffee during your non-fasting hours so that it do not cause dehydration during the fasting hours.
Okay. So brushing after your suhoor meal and keep yourself well hydrated and try and avoid junk food as much as possible.
Exactly.
I think the last one is the most difficult part for everyone. And so doctor, what have you, in your observation, what are the most common dental problems faced by patients during this month of Ramadan, and what are the measures that we can take to prevent it?
The first problem what most of the people who fast face during the month of Ramadan is halitosis or bad breath. This can be circumvented by using a mouthwash and brushing after the suhoor meal and in the night before you go to bed. The second most common problem is dryness of the mouth or dehydration overall is circumvented by drinking a lot of water and having fruits, vegetables, juices and soups during your non-fasting hours and avoiding foods that make you thirsty like oily foods, fried foods and carbonated drinks.
Okay. Now let's come to the area of your expertise, and that is braces. It's a common sight, these days we observe so many children wearing braces. So could you please elaborate on what exactly this is?
See, braces are special devices or an appliance used by an orthodontist to bring about the tooth movement. That is, these apply mild continuous pressure onto your teeth, which in turn brings about certain changes which modifies the tooth root and the bone, which in turn brings your teeth into a perfect alignment, and finally we get a perfect smile.
Okay. And what are the different types of braces available?
See, these days there are many different kinds of braces. The first one is your traditional metal braces. So these are the most commonly seen or what everybody pictures when the term braces comes to your mind. So this is silver or metal in color, and it consists of brackets and wires. The second kind of braces is ceramic braces. It is tooth colored. Okay. That is, the bracket and the wire is white in color or it merges with the tooth. So it is less visible in comparison with the metal braces.
Okay.
The third kind is known as self-ligating braces. It is slightly advanced kind of braces and it do not contain any elastics or the different colors what you see in the normal traditional braces. Okay. So it is more advanced and different complex cases can be treated very easily with these advanced self-ligating braces.
Okay.
And the fourth one or the most advanced and the expensive type is aligners. So these are a set of invisible trays which the patient has to wear throughout the course of the treatment. So every 2 weeks you have a new set of tray or aligner which you need to keep changing every 2 weeks.
Okay.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
I'm sure a lot of parents and kids have this question or fear in their mind, especially when they see other kids wearing braces. Does it hurt?
See, definitely braces don't hurt, or it's designed in a way not to hurt anybody. But a mild amount of discomfort or the adjustment phase happens during the initial days. Once your teeth, your tongue, your cheeks get used to it, it's completely pain-free. Again, it's like how you wear a new pair of shoe. The first few days you might feel a mild amount of discomfort, but you gradually get used to it.
Okay. And we have a parent who has written in a question to us. She knows how do you know when to visit orthodontist, when to take your child to the orthodontist to assess and to evaluate?
Any age is a right time to meet an orthodontist. According to the American Association of Orthodontists, they recommend that a child needs to be taken for an orthodontic evaluation around the age of 7 to 8.
Okay.
We say this because from the age of 9 to 11, a rapid growth phase happens. So if this child has any defect in their growth pattern, we can use this growth phase to our advantage by using certain growth modification appliances. Nevertheless, if you wish to have a perfect smile, any age is considered a right time to visit an orthodontist. One among 4 patients of mine are adults. So no matter what age you are, if you have a good gum health and the surrounding bone is strong enough, you can undergo orthodontic treatment even at the age of 50 to 55.
Okay, that's good to know, because we were all under the impression that only kids, up till the age of 18 or 20 normally wear braces. So it's always nice to know that, even at a later stage in life, your problem can be rectified.
As I earlier said, age is not a limitation.
Barrier.
It's your oral
Gum
health
health
and the gum and bone structure that's more important and a deciding factor to undergo orthodontic treatment.
Okay, and is it mandatory to have the teeth extracted before you begin the treatment of braces, or it depends on the case and the jaw structure of the child? How do you evaluate that?
See, every course of orthodontic treatment is tailor-made according to the malocclusion that we face or the problems that the child has.
Okay.
We don't have one fixed solution for all kinds of orthodontic treatment. These days, with certain advancements in the braces, most of the orthodontic cases can be treated without extraction. But certainly in some cases where the teeth are very much proclined in front, both in adults and children, extraction may be necessary to get that perfect result to attain the maximum stability.
And what is the normal duration of this orthodontic treatment? How long is the period? How long do they have to wear it?
See, that depends on the complexity of a case. On an average, it ranges between 18 to 24 months of fixed active orthodontic treatment. Again, once the treatment is done, we give them something known as retainers, which is to be worn for the next 1 to 2 years or a little more depending on, again, the severity of the malocclusion.
You mentioned about retainers just now. So could you please explain to us what are the different types of retainers and how does that procedure work?
See, retainers are an equally important part of an orthodontic treatment, because after a period of 1.5 to 2 years, you get a perfect smile. But we need to retain this smile for the rest of your life. Hence, we advise the patient to wear something known as retainers. Basically, there are 2 different types of retainer. One is the removable retainer, the other one is the fixed permanent retainer. The permanent retainer is advised in severe complex malocclusion and it stays in your mouth for the rest of your life or at least 8 to 10 years. The removable kind, as the name suggests, can be removed and worn back by the patient themselves. Again, they are of 2 types. One is the transparent, completely invisible kind of removable retainer, and the other one is the single wired kind of removable retainers, which I'm sure many of you would have seen. So retainer is equally important part of an orthodontic treatment.
Okay, so it's very essential to make sure that there's no relapse. If
Exactly.
the child is not very persistent, does not religiously wear retainers, then are there more chances that your teeth may go back to its previous
Exactly.
stage?
Relapse itself is caused by many factors like your wisdom tooth erupting, or the patient has severe mouth breathing or a habit of tongue thrusting.
Okay.
So relapse or the retention part is equally important, and each patient will have a different retention protocol.
Okay.
We don't have a fixed pattern of retention wear for all the patients.
Okay, so it's case based.
Exactly.
Okay. And could you also give us an idea about the cost of this treatment? You spoke about 4 different kinds of orthodontic treatment. So for the benefit of the viewers, if you could just tell us how expensive this is?
See, in the earlier days, when the term orthodontics comes to everybody's mind, they find it very expensive. But these days, we have multiple installment patterns, and it is more affordable and accessible. And we have packages starting from BD 25 per month, and it's available at all branches of Al Hilal.
Thank you so much, Doctor, for your valuable tips and information. Any takeaway tips for our viewers?
During Ramadan, the most important tip is to brush after your suhoor meal and to keep yourself hydrated enough during the non-fasting hours to avoid dehydration and halitosis and bad breath during the fasting hours.
Thank you so much, Doctor, for throwing light on the various dental issues and especially about the braces. Viewers, the smile is the most inexpensive and the best accessory that you can always bear. So keep smiling, keep spreading joy and happiness. Catch you all again next week, same time, with a different topic. Till we meet again, stay healthy and stay happy. This is Anupama signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.